provision of healthcare, the actual investment in people's health, has changed dramatically, while the insurance industry hasn't, and the way we buy healthcare hasn't. 80 years ago, we created this employer-sponsored system because we were trying to offset inflation, so no wage increases, but we could offer benefits. At the same time, there was this expected population explosion. And then we had the Hill-Burton Act in the 50s that built hospitals everywhere. And so we created both demand and supply increases that have not slowed since. The population boom happened and all of this costs. I mean, if you look at the percentage of GDP going to healthcare, it's now just under 20%. And in 1984, it was 9%. So as you look at these changes over time, we've just outrun our ability to afford the way we do it.
If 50% of the population is going to be obese, you're running into a buzzsaw. You can't. There's no health care that is going to be great enough to handle the lifestyle problem.
Your zip code matters more than your genetic code in your health. So how you live and where you live actually matters. And so we have huge issues in rural communities around the country. But probably the most important thing is that healthcare has now become very individualistic. I want it to be fit for me. And when my employer buys my healthcare coverage, they buy for the average.
Right. So what would you do? I mean, look, Elon Musk was out there just earlier this week. We were talking about it yesterday, suggesting that the answer is if we could get a huge percentage of Americans on GLP-1s, we could bring the cost down of healthcare in a remarkable way, especially if you could get the price of GLP-1s to come down in a remarkable way. What would you do?
What I would do is I would eliminate employer-sponsored insurance.
You say that, and it stops my heart a little bit, because those of us who have employer health care think, oh my gosh, getting thrown in so everybody's dealing with Medicare Advantage, that seems like a pretty terrible thing. And I would argue that my health care insurance, while I'm not always thrilled with it, at least I have an employer who can go and argue for the mass of us. There's a lot of us, and that at least has some bulk. If I'm out there on my own, it feels like there wouldn't be any protection that comes with it.
The ability of your employer to negotiate against a large insurance company that has much a larger relationship with the provider community is very stinted now. You can't get stunted. You can't do it now. And
you're saying the companies have no leverage?
The companies have no leverage now.
Interesting.
And you look at the basic foundation of our economy, which is small business and middle market, they have none. And they're seeing double-digit rate increases when just over in the individual market, our trend's been 3.5% each year.
Automatically, I think, okay, you're going to take all the healthy people and the young people and leave the people who either are older, have cancer or some other disease, have children who need coverage because of special needs or along those things, and they get left out, and they're going to be the ones who are left holding the bill, literally.
Well, number one, the largest pool in America is the individual market, with 24 million people.
Affordable Care.
Affordable Care Act. And in that marketplace, everybody gets the same rate, regardless of their illness. So there's no underwriting of the individual based on their illness. And they get subsidies if they're under certain levels of the income, of the federal poverty level, in order to help afford that. And so when you look at all of that together, a sick person doesn't get penalized. Healthy people get to buy what they want. 75% of all physicians in America are in the ACA. So I can find my doctor. I can buy a plan design that fits me, where often with a large employer, I'm overinsured because I've got the coverage that covers even the sickest people on a level premium. There's no employer large enough to get the same level of risk adjustment that the ACA has.
That at least in your area, in some places, we have managed to keep healthcare costs within the rate of inflation or below.
No, if you look at the overall ACA and its rate of increase over the last 5 years, it's been at or below CPI.
Mark, I always love having you here because you understand the system like few others. I don't agree with you on everything. I'm a little scared about the idea of giving up employer health care that I've had my whole life, but I appreciate everything you bring to us and what you teach us along the way. So please come back again.
Yes. Were you scared when you went to a 401k?